Then I have those ones are reactant. And reactant, the reason I have reactant, so anaphylactic shock. So basically when you have a reaction to something, so a bee sting or something like that. There's different categories again. You can have like mild, moderate to severe. And the reason I create reactant is that if you look on the package, it says every 12 hours, it's good for 12 hours. They last longer and they don't have the somnolence of Benadryl. So obviously when you have a very bad one, Benadryl is the way to go. But the cool thing with reactant, Claritin is not good. There's a lot of literature that have shown that it's not very effective. You might as well take a Tic Tac and pretty much almost do the same thing. But the reactant one has like some good literature that backs it up. So what I carry is, so I carry little reactants, and so if I start having like a hay fever or something, I'll take those before I take Benadryl, because Benadryl will feel sleepy. And so if you're about to climb a mountain or something, you feel sleepy, it's never really the time. So reactant's a little bit better for that, and also they have that longer effect. So if you're in the middle of the woods, and even if you give the epi and you give the Benadryl, well, this will kind of prolong as well, so it gives you time to get out. So it has kind of a double purpose to it. As well as I carry the Benadryl and tablets, so I can give for anaphylactic shock. So what's missing here is my EpiPen, and I'm buying one. I'm having trouble. It's hard to get the twin pen, which is the most recommended one. So the difference between an EpiPen and a twin pen is that the EpiPen is one shot. So you give yourself in the leg, push, and the needle comes out, it's one shot. The twin pen is that there's another shot. So sometimes people will have, especially if you delay your transport, so let's say you give your EpiPen, well, sometimes they'll drop after the medication ran off and they'll have another reaction to it. Well, if you're in the woods or in the wilderness and it takes you 6 hours or 7 hours to get out of there, that means that after your 4 or 5 hours, that usually here in the urban you would be in a hospital, then you're having difficulty. So the twin pen, you can undo the mechanism, and then basically you take another, and there's another shot of epi inside. So now you have 2 shots. So basically it almost covers 12 hours of EpiPen. 4 to 6 hours usually. That's what they cover. So that's what's missing. So I'm buying one soon, but they're expensive. They're about like $100 here. So glucose for hypoglycemia. Even as somebody like in diabetic and stuff, you can always give kind of glucose, even if you don't know quite their sugar, because you cannot. It's worse if you don't get sugar, but you cannot really do too much harm by giving too much sugar, unless you give like over and over and over. But like, so in an emergency, even if I don't have a sugar level, this will help pretty good. So that's what I have here. As well here, and we'll discuss about this. This is what we call a Foley. So this one is this is what we call a Foley. So basically, as you can see, here's my lovely wraps that I wrap almost everything now. But this is what it looks like. So basically, it's a little tube there, and there's different purposes of this. I'll do almost a video just on this. And those ones are specials. When you use a Foley, so basically if you've ever been in the hospital, this is what we put in the bladder of people to get some urine out and stuff. Over here, there's a little balloon, and you can inflate that with a syringe. And there's different size of it, and this is what we call 30 cc's, which is 30 millimeters of air or liquid or whatever you're going to put in. But basically it's a bigger balloon than a regular Foley's. and we'll discuss a little bit more. I'll do a whole video on this one because it has a lot of, it's a little bit like a safety pin of wilderness medicine. So this is the Foley. And over here I got the Atomometer, and those ones are the disposable ones. So basically how they work, I don't know if you can see pretty well, there's little dots there, and you put that on the tongue of the person, or in the cheeks, and what it does is that each dots, they're green now and they'll become like a different color, and where the colors stop, it tells you the temperature. So it can be used, but if you're going to use them for hypothermia or hypothermia, so very cold or very hot person, you need a special thermometers, because a lot of the thermometer, they stop under the time that you get. Those ones are Fahrenheit, so I'm not too familiar with Fahrenheit, but it goes to 96 to 104. So I think it's kind of like probably like 39, I would presume, and maybe about 35. Usually hyperthermia, you want to go below 35, and hyperthermia, you want to go a little bit higher. But I carry them because I had them in the kit and stuff, but I'm doing a video pretty soon on both subject, and it's good to know, but you don't really need to know the temperature. All you need to know is, like, am I getting better or wrong or worse? So there's other signs and symptoms than taking temperatures, and so you can carry one if you want, and a lot of people, they recommend to have one, but sometimes just by the symptoms of what the person says, you can almost guess what their temperature is going. So it's a little bit easier to manage with that. This is a bunch of foods and drinks, and again, it's for more for the hypothermic or somebody with diabetes as well, because if you give sugar and they're low, very low, well, you need to give something else, because this will boost them up, but then they'll go down. So I'll be able to prepare a little meal or something. And if you're hypothermic, then I can start giving maybe fluids or something, depending where they are in the hypothermia. We'll discuss that a little bit later, but that's why it's in the medicine stuff.